talk about like the differences in being versus to see a doctor?
Yeah.
How does that like mindset in China affect preventative care? Are they more accepting of preventative care or less accepting?
Well, actually, put it this way, the Chinese traditionally are very preventive oriented, and a lot of herbs are really actually oriented to prevention. But unfortunately, in China, they don't have the family medicine or family doc system. In a sense, even you have chronic disease, you don't have routine follow-up. Only when you get sick, you go to the hospital, see a doctor. And a lot of times the expectation is that they will get a prescription. And that's what the care is at most of the times. Actually, I see a lot of actually Chinese folks here on campus and coming. Sometimes I kind of have to do something for them because they have a cold, we call this upper respiratory infection, most virus infection. And trying to explain to them, this is virus infection. If I give you medicine, it takes 7 days. If I don't give you medicine, it takes 1 week. In a sense, medicine doesn't work. It's really actually you have to drink a lot of water and rest, and your body will overcome it. A lot of times they don't, really expect you to give antibiotics. So in China, the anti-inflammatory medicine and antibiotics are the same thing. When talk about 消炎药, they're mini antibiotics. But here we have an anti-inflammatory medicine. Well, I keep explaining that, okay, you need some anti-inflammatory medicine, not antibiotics. Now actually there's some data showing that in China, the drug resistance is huge to antibiotics. Anybody get a sneezing, and we have allergy here, I take Zyrtec, and unfortunately a lot of people, Chinese people, they expect you get a prescription of antibiotics from the physician. So really actually prevention is rooted in the culture. Even like drink water, right? So you have Chinese folk visit from China. The first thing that they were amazed in the winter in the restaurant, they provide you ice water, right? They expect to get hot water, hot tea, and they think because the cold water in the body can generate disease. A lot of times probably it's true, but that's changing. I said there's no family practice or community system in China that's been changing now. Now actually in China 2 years ago, we were pushing this idea. Actually, we pushed this idea so you need a formal training of family medicine. Finally, China seems to happen dramatically. If the top leader says yes, we're going to change it. So we've been trying to push this concept of community-based family medicine since 2005, and doesn't go anywhere in terms of training of physician. But what we can do is invite the physician come here, we train them, they go back, spread the disease. But then 2 years ago, the Minister of Public Health, Dr. Tseng, basically said now every major institution need a training program like I said 3 years training in family medicine. All of a sudden, it's all over the country. But I think there's a lot of they have to do in terms of curriculum. So they have this program that they don't know what to do. So that's one thing we can help a lot.